Hello, welcome to Chapter 14, the Male Reproductive System. So today we're going to go through the main terms for the male reproductive system, abbreviations. We're going to break down and deconstruct some words. We're going to work on spelling and pronouncing words for the male reproductive system, as well as different disorders of the male reproductive system. So let's get started with this male reproductive system. The male reproductive system contains gonads, which are their primary sex organs. Males have two testes. These are those primary gonads that make testosterone as well as sperm. The secondary sex organs would be that penis, the scrotum, and then the duct system that allows that sperm to travel from the testes out through the penis, includes the epididymis, the ductus vas deferens, and the urethra. And then we have glands. These glands, accessory glands, are going to produce different substances that are added to that semen, or that sperm that produces that semen, I should say. There's the prostate, the seminal vesicles, and the bulbourethral glands. So let's go through some of these. The perineum is a diamond-shaped region between the thighs with the anterior border at the pubic symphysis and the posterior border at the coccyx. The scrotum, there's two compartments, each containing its own testes. The scrotum is used to store sperm and at a temperature a few degrees cooler than the internal body temperature. So that testes is the site of production of sperm and testosterone. The penis, the male copulatory organ that conveys urine and semen to the outside. The testes is the site of production of sperm and testosterone. The testes gets its blood supply from blood vessels that follow that spermatic cord. The testes also has a nerve supply. So, because there's different hormones that are needed to help those testes produce sperm, but they also have sensory nerves. The epididymis is a coiled tube on the back of the testes where sperm can live, according to your textbook, 12 to 20 days, but they can actually live up to like 3 months in there until they mature in there for up to 20 days, but then they can be stored in there for up to 3 months. Spermatogenesis is the process in which male sperm differentiate, or germ cells differentiate into sperm. That root and combining word spermato. Spermato means sperm. We've been through is creation. The male secondary sex characteristics would be enlargement of the testes, the scrotum, and the penis. Development of pubic, axillary, body, and facial hair. And all of this is going to occur at puberty. During puberty, like the sex hormones, testosterone gets sent out in bursts, large bursts. These bursts of this hormone will help increase muscle mass, and it makes the larynx larger to create a deeper voice. The sex drive is also known as the libido, and testosterone does affect the female's libido. Females do get testosterone. We mentioned it that females get testosterone from the adrenal glands, those androgens, and it does help to increase that sex drive. So, spermatogenesis. Spermatogenesis starts with these germ cells. At this point, these cells have 23 pairs of chromosomes, or 46 in total. This is a process that is occurring in these seminiferous tubules. These germ cells are first going to go through mitosis. Mitosis is where they make an exact replication of themselves, those same 23 pairs of chromosomes. From here, these cells are going to go in through meiosis. Meiosis is a process where those two identical cells from those germ cells, so we have one cell that splits off into two cells. These are this two identical copies that go through mitosis. These cells now are going to go through meiosis. I spelled that wrong, sorry. Let's fix that. meiosis, meiosis, where these cells are going to break off and give us 4 cells. The difference is this cell, and this cell all have 46 chromosomes. These cells now only have 23. Oops. There's that dyslexia coming back. Those 23 chromosomes, and this is what allows that sperm to come together with that ova, that female egg, and create those 46 pairs of chromosomes again, 1 pair from the father, 1 pair from the mother. So let's look at some different disorders. Testicular torsion. This is a twisting of the testes on its spermatic cord to cut off blood supply to the testes. A varicocele is a dilation of the veins in that spermatic cord. A hydrocele, again, is telling us what it is. Hydro is fluid in the sheath surrounding the testes and the epididymis. A spermatocele is a benign collection of sperm in a sac formed in the epididymis. All of these conditions are going to require surgical intervention. Cryptochiasm is when one or both testes fails to descend from the abdominal cavity during development or right after development, because the testes technically really don't fully descend until after birth. That epididymitis is an inflammation of the epididymis. Orchitis is inflammation of the testes. And then testicular cancer, it's usually, as your book says, it develops in males under 40. It's usually between the ages of 15 to 35 years old is when you're going to find testicular cancer. It's found in younger people. So let's deconstruct some words. Epididymis. Epi is that prefix that means above. And then didymis means testes. So epididymis is the tube that arises from the testes. It's found kind of above and behind. Spermatogenesis. Spermato is that combining form. That means sperm. And then that genesis is that creation. So we're creating sperm. Cryptorchiasm. Crypt. That prefix means hidden. Orc means testicle. Cryptorchism is a condition. So cryptorchism is when the testes fails to descend from the abdomen into the scrotum during fetal development. So gonad and sperm, these are both mean seed. Penis means tail, and torsion means twist. So let's look at the plural, or the singular versus a plural. Gonad, the plural of gonad is gonads, just add an S. The singular form of sperm may also be called spermatozone. The plural form is spermatoz, not S, zoa. Testes is singular, testis versus testes. There we go. So the adjective form, testicle, testicular, scrotum, scrotal is that adjective form. Sperm, spermatic, and penis is penile. Androgen. Androgen, that root for androgen is that andro, that's that combining form. It means masculine. Gen means create or produce. So an androgen is a hormone that promotes masculine characteristics. Testosterone. Testo is that combining form, means testes, and then sterone is that suffix for steroid. Testosterone is a powerful androgen produced by the testes. Seminiferous. That root or combining form, semen, means semen. Fer means to bear or carry, and then that suffix ous means pertaining to. So seminiferous means pertaining to or carrying sperm. In mitosis and meiosis, this common suffix osis means condition. So mitosis is cell division that creates two identical cells with 46 chromosomes. Meiosis refers to two rapid cell divisions resulting in half the number of chromosomes. Hydrocele, spermatocele, and varicocele all have that suffix cele. This suffix means swelling. Hydrocele, water, so collection of fluid in the space of the tunica vaginalis specifically. Spermatocele, spermato means sperm, so it is a cyst of the epididymis that contains sperm. And varicocele, varico means varicosity, so varicose veins in that spermatic cord. Orchitis is inflammation of the testes, where cryptorchism is that failure of one or both testes to descend into the scrotum. Epi means above. Didymo is that combining form for testes. Orc means testicle, and itis means inflammation. Epididymo orchitis is inflammation of the epididymis and testicle. Set. Self-examination of the testes, STD, is sexually transmitted disease, which is also now known as STI. So instead of disease, it's infection. Because a lot of those are treatable. So they're not like a disease that's constantly there. It's an infection that can be treated and gone away. So let's look at all the accessory portions of the male reproductive system here. So the spermatic ducts are the pathway that the spermatozoa, or those sperm, after they exit the testes and proceed to ejaculation. After the sperm cells mature in the testes over a 60-day period, they move into the epididymis for storage. They can stay in that epididymis for up to 3 months. To be ejaculated, the sperm move into the ductus or vas deferens, the ejaculatory duct, and finally to the urethra to reach the outside of the body. The 2 seminal vesicles are located on the posterior surface of the bladder. They produce a sticky fluid with high fructose content. That fructose helps to provide energy for the sperm. There is one prostate gland that is located immediately below the bladder and surrounds the urethra and ejaculatory duct as it joins with the urethra. The prostate secretes a milky fluid containing an enzyme that helps keep the ejaculate liquefied. Prostate-specific antigen is that, or enzyme is that enzyme that helps to do this, and prostate-specific antigen is actually a screening enzyme for prostate cancer. The bulbourethral glands are located below the prostate on each side of the urethra. They secrete a clear, slippery, alkaline mucus. That seminal fluid contains those elements produced by those 5 glands. That seminal fluid and sperm is what creates that semen. Prostate is the organ surrounding the beginning of the urethra at the neck of the bladder. Ejaculate means to expel suddenly. Motility is the ability for spontaneous movement, and residual is pertaining to anything left over. Prostate, we can turn it into prostatic for its adjective form. Semen, seminal. Sperm, spermatic. Ejaculation is ejaculatory in its adjective form. So there's different disorders of the prostate gland. We have benign prostate hyperplasia, or BPH. This is a non-cancerous enlargement of the prostate, and it affects 90% of men by the age of 80. Very large number. It compresses on the urethra, which causes nocturia, peeing at night, polyuria, constantly having to go to the bathroom, and dysuria, which means difficulty urinating. Prostatic cancer affects about 10% of men over the age of 50. It can be asymptomatic if it does not compress on the urethra, in which case it is given the same symptoms as benign prostate hyperplasia plus hematuria. So it causes blood in the urine. Prostate is screened by a digital rectal exam, and prostate-specific antigen changes in the blood. Prostatitis is an inflammation of that prostate gland, usually caused by a bacterial infection. DRE, that digital rectal exam, it's done by sticking a finger up through the rectum to feel that prostate, to feel enlargements, to feel for irregularities. This is milliliter. Then prostate specific antigen is a blood test that is used to monitor the state of the prostate and prostate cancer. Aneurysm and cryptorchism. An, number means absent. So aneurysm is that absent of the testis or testes, one or both. Cryptorchism is a failure of one or both of those testes to descend into the abdomen. Hyperplasia is an increase in the number. This one is number of cells in a tissue and an organ. And hypertrophy is an increase in size of those cells. This is the concept. These are two terms that students like to mix up. So plasia is the number of cells, increase in number. Hypertrophy is an increase in the size of the cells. A vasectomy is an excision of a segment of that vas deferens to produce sterility. Vasovasectomy is the reversal of that vasectomy. This can be reversed. So let's look at some abbreviations. BPH. Benign prostatic hyperplasia. BEP, benign enlargement of the prostate. PSA, again, prostate specific antigen. Then TERP, transurethral resection of the prostate, the surgical treatment for BPH. And then NIH is National Institute of Health. Okay. The connection between the corpus spongiosum and the glands is that corpus spongiosum actually becomes the glands of the penis. An erection is achieved by the two corpus cavernosa becoming filled with blood. Ejaculation occurs when that sympathetic nervous system stimulates the smooth muscles of the spermatic cord or the spermatic ducts to contract, which causes that ejaculation to happen. Circumcision is that removal of that prepuce or that foreskin. There's not shown any like benefits, health benefits to it, but it has shown in African countries to reduce the transmission of AIDS. So it's more done for cleanliness. Trauma can vary from a penis's being caught in a pants zipper to a fracture of an erect penis during vigorous sexual intercourse. Priapism is a persistent, painful erection. It can be caused by drugs, like Viagra, blood clots, or spinal cord injury. And then cancer of the penis occurs most commonly on the glands. It is rare in men who have had a circumcision. So this is another reason why circumcisions can be done. Sexually transmitted diseases or infections, such as syphilis and chondromata acumina, can cause lesions on the penis. Erectile dysfunction is the inability to achieve or maintain a satisfactory erection. Medications can cause erectile dysfunction too. It can be mental reasons. And then premature ejaculation is when a man ejaculates so quickly during intercourse that it causes embarrassment. And then that embarrassment will sometimes lead to that erectile dysfunction. Balanitis is an inflammation of the glands and prepuce with bacteria or yeast. Phimosis is a constricted prepuce which can lead to a balanitis. Paraphimosis is a condition in which a retracted foreskin cannot be pulled forward to cover the glands. Erection is the distended and rigid state of an organ, and in this case, the penis. Impotence is the inability to achieve erection. Circumcision is the removal of part or all of the prepuce, and then spermaticide is an agent that destroys sperm. Corpus means body and is used to refer to the shaft of the penis. Glans means acorn and is used to refer to the head of the penis. Prepuce means foreskin. Prostate means one standing before, and it is used to refer to the organ surrounding the beginning of the urethra. Gonad means seed, and it is used to refer to either the testes or the ovary. Okay, there's 15 million cases of sexually transmitted diseases or infections reported annually in the United States. Chlamydia, it can be asymptomatic and is diagnosed by testing a swab from the vagina or the urethra and is treated with antibiotics. Pelvic inflammatory disease occurs when untreated chlamydia ascends into the female reproductive organs. And then gonorrhea is caused by a bacterial infection that may be asymptomatic or may cause vaginitis or urethritis, bleeding, and dysuria. Gonorrhea is diagnosed by testing a swab from the vagina or urethra and is treated with antibiotics. Syphilis is caused by a spirochete. It can spread through the bloodstream to any organ. The first sign of syphilis may be a canker at the site of infection. And that canker is that primary lesion of syphilis. Trichomoniasis is frequently asymptomatic in males, but causes a frothy yellow-green discharge in women. Genital herpes is caused by a virus that causes blister-like painful sores, fevers, joint pain, and tender enlarged lymph nodes. The human papilloma virus causes genital warts in males and females. That human papilloma virus in women can lead to changes in the cervix that are risk factors for cervical cancer. Human papillomavirus can be prevented through immunization. Molluscum contagiosum is a viral illness that can cause small shiny bumps that can appear anywhere on the body. Then human immunodeficiency virus, or HIV, is a virus that attacks the immune system and usually leads to acquired immune deficiency syndrome, AIDS. So let's look at these. Which one of these is spelled correctly? Canker or canker? CHANCRE is correct. Chlamydia. CHLAMYDIA. Gonorrhea. GONORRHEA. Papilloma. PAPILLOMA. And then syphilis. SYPHILIS. Abbreviations. Center for Disease Control and Prevention. Technically. PAP, Papanic Lao. It's a test. And then HPV, human papilloma virus, HSV2, herpes simplex virus 2, PID, pelvic inflammatory disease, TB, tuberculosis. Okay, let's look at some procedures in pharmacology here. So that digital rectal exam is using a lubricated gloved finger inserted into the rectum. A prostate-specific antigen is a protein that is specific to the prostate gland that can be detected in blood tests in males. Then a prostate biopsy is commonly performed under ultrasound guidance to remove a sample of that tissue. Circumcision is that removal of that foreskin. Orchiopexy is a surgical procedure to move an undescended testes. Orchiotomy is the removal of one or both testes. Urethrotomy is incision of the urethra. A vasectomy is an incision, or is when that ductus deferens is cut in two places and the ends are cauterized and tied together. And that vasovasectomy is the procedure to reverse or repair that vasectomy. Alpha blockers are used for BPH, that benign prostate hyperplasia. They relax the bladder neck muscles and the muscle fibers in the prostate gland. 5-alpha reductase inhibitors are used to block hormones that spur the growth of the prostate gland. Prostate cancer can be treated with hormone therapy using medications that stop the body from producing testosterone, which prostate cancer needs to grow. Anti-androgens block testosterone from reaching cancer cells. Antibiotics are used for bacterial infections of the prostate gland. In phosphodiesterase type 5 inhibitors, or PDE5, such as Viagra or Cialis, are used to treat erectile dysfunction. So that PDE, again, this is a publisher mistake, should be 5. Pet color, there we go. Is that phosphodiesterase type 5 inhibitor. And then TULIP is transurethral incision of the prostate. So unlike other organ systems, the reproductive system is technically not essential for survival. However, without that reproductive system, the human species would not survive as a whole. So the male reproductive system contains those 2 testes that sit in that scrotum and contains that epididymis with those several different spermatic cords and the different glands that contribute for the semen to make semen, which can be used with the female reproductive system, next chapter, on reproduction. Thank you very much for listening. This was the male reproductive system. Have a wonderful day. Bye.